My name is Eileen Handberg, and I am a research professor of medicine at the University of Florida. And my responsibilities at the University of Florida are multiple. I'm a nurse practitioner by training and licensure, and I have my PhD. And my role at the university is to be responsible for research in cardiology and also take care of patients. So my job here today, I think, is to tell you about cardiology in general, and tell you about career opportunities and why I love cardiology, and hopefully maybe have you think about cardiology as an opportunity for you. So I started out as a nurse, and decided to go back to school, and ended up getting a master's degree and then a PhD, and ended up being very interested in the research side of cardiology. So most of the drugs that your parents or grandparents take for high blood pressure or for their cholesterol are drugs that we've worked on to try and get approved. The guidelines for how to take care of patients with heart disease are research projects that we've done over the last 30 years in cardiology. So it's an incredibly interesting kind of career if you go into medicine in general or nursing. It's always changing, it's always evolving. The way we used to take care of heart attack patients 25 years ago was very different than how we take care of them now. The technology has developed. It would have been 25 years ago if your father or mother was put in the hospital for a heart attack, they probably would have been in the hospital for a week. Now, unless there's complications, they're out in 2 days. Heart attacks are caused because you have generally a buildup of plaque in combination with perhaps a clot forming. And so the blood flow to the heart muscle is disrupted. And one of the things that has changed is you get people to go to the emergency room right away. You take them into the cath lab, you find out where the blockages are, and you open them up right away. So there isn't long-term damage to the heart muscle. And so that's really changed how well people recover from heart attacks. And so we do research in every area of heart disease, whether it's a rhythm problem, whether it's a plumbing problem, or or a muscle problem. And so there's a lot of opportunity. In cardiology, just like in medicine, there's so many jobs that you could have in any role that you decide. So if you decide you want to be a physician, or you want to decide that you want to be a nurse or a nurse practitioner or a physician assistant or a pharmacist, in medicine and in cardiology, there are incredible opportunities. So you could work in a hospital environment. You could work in an outpatient environment where you see patients who come into clinic and you follow them, kind of like your general family practitioner who follows a whole group of patients in their community for 20 or 30 years. But there are a lot of other opportunities. So, for example, and you see a lot of this now with the press around COVID, right? So there are a lot of people who work at the National Institutes of Health who are trained in cardiology or infectious disease, so that those people don't necessarily take care of patients, but they're doing research around disease processes. Or a physician or a nurse practitioner or a pharmacist may go to work for the CDC and do surveillance around pandemics like COVID-19. You see a lot of physicians and healthcare providers moving into the technology realm. So you have people who are interested on the medicine side or the cardiology side, who are also kind of have engineering minds. They want to know how things work. And so those people often, they'll see something that isn't working. Like say you're in class and you don't like the way Zoom is working, and you say, oh, there's got to be a better way to have a virtual class. And you're very good at software and programming. You might develop Zoom, Super Zoom, right? Which makes your ability to interact in a class way better than just me looking at you. Say you have the ability, rather than just having chat, you have super animation, and so it keeps people engaged. That's not unlike what happens in cardiology. So people have multiple areas of interest, and so a lot of people combine those areas of interest into their career path. So you have lots of entrepreneurs who might say, who were big gamers when they were your age, and they turn patient education materials into an online game. And so they get involved in the software development side along with being a provider. So they end up being consultants to Google and Verily and some of those groups. There are people who go into the pharmaceutical industry who decide that their careers are going to be to help try and develop new drugs or new devices. So there's that opportunity. Some people go in and have careers where they take care of patients, and then they say, gosh, the government policy around healthcare coverage is terrible, and I want to change that. And so they go into politics, and then they become a sort of patient representative in the federal government. So I look at cardiology as one piece of what I do. And then I do research, and then I do patient education, and then I do teaching. And so I have the ability in this career that I've chosen to take advantage of all my strengths and get the opportunity to try a lot of different things. You may decide you, again, want to be a cardiologist. And even within cardiology, there are doctors who focus on arrhythmias. There are doctors who go to the cath lab and put in new valves or open blood vessels. There are general cardiologists who read your echocardiograms to look how your heart is squeezing on a imaging technique that we use, and then they see patients in clinic. So there's lots of different areas, and whether you're a physician, a nurse practitioner, or a pharmacist, all that diversity is available. There are pharmacists who specifically are pharmacists who deal only in cardiology. And they tend to be experts in blood thinning medications, because a lot of our heart patients are on blood thinning medications to try and reduce the likelihood that they're going to have a clot, and reduce their risk of stroke or heart attack. So there's so many places that you can take a love of any area of medicine. Again, I came into this very kind of just luck. I actually wanted to go into politics and or be a news broadcaster. And I decided when I was early in college that broadcasters, a lot of the reason they got their career paths is because of how they looked. You know, blonde, blue-eyed women, you know, being the sports reporter, and I just felt like that wasn't what I wanted. I wanted to be able to move based on my knowledge and skill. And that's just the way I felt. And I'm not, that's a stereotype and it's not necessarily accurate, but when you're in the public facing environment, how you look does make a difference, right? You know, they tend to, you know, select people who have an image. So anyway, I decided I was going to go to nursing school. totally out of the blue. And at that point, I did it because I thought I could always get a job. I could move anywhere across the country. And so I went to nursing school. I ended up in a hospital where I ended up working with a group of cardiologists who were so much fun to work with. They loved cardiology, and I got from them that passion about taking care of patients with heart disease. And so I think that, you know, there's a tendency sometimes to go into careers because your parents want you to, or you think it's the right thing to do. But careers in medicine and healthcare take a lot of commitment. And so it's something you really need to want to do yourself, not because somebody is encouraging you to do it. It's a long trail of education, taking care of patients. You know, you've seen this a lot on the news, the staff who are working all of these hours to take care of all these COVID patients. It's emotionally draining to watch people not do well and to die. It takes an emotional toll. So if you're not in it because you're really passionate about it, you know, you may end up struggling. So whatever career path you decide on, you really should try and pick something that you love to go do that every day. I mean, not every day is wonderful. I go to, you know, there are some days I get up and say, oh, I do not want to go to work today. But in general, I love going to work. It's always something different. It's always something new. And that makes it way more enjoyable. You're going to spend a lot of time in whatever career path you choose. That's going to be your second family. And so you need to like that family and what you guys are all working together towards. You know, when you guys are going to school, hanging out, it's, you know, it's not a great year to talk about school because, you know, you guys are all doing Zoom, and how can Faza, is it Faza Delgado? How do you pronounce it?
FISA.
FISA.
Yeah.
So FISA doesn't necessarily know Nicholas, who's down here in my little corner here. And so Zoom has made it hard, but you know, half the fun of going to school is hanging out with your buds and, you know, having experiences and doing that thing. And so work is not going to be that much different. And so if you're all there for a common good, then it makes things really enjoyable. I mean, it used to be we would get called in the middle of the night to go to the cath lab and take care of patients. And it could have been 3 a.m, but I knew that when I got there, even though I didn't want to drag myself out of bed, that we were going to help a patient and that everybody there was excited to be able to make a difference. You know, if I don't like the people I work with, or I don't really like my career, then that would have just been terrible. And I have some of the fondest memories of getting up at the, you know, 2 a.m. and making a difference in someone's life. So, you know, you need to think about that. Careers in medicine and cardiology do take a lot of effort in terms of, you know, doing your middle school and your high school and your college and having good grades. It's very competitive to get in these days. So you have to be sort of focused about what you want to do. And have sort of a vision for yourself. But I would tell you that, you know, the vision you have and what you end up doing may be different things. You know, you can plan all you want and somebody can really throw a wrench in that and you have no control over it. So you have to be a little bit flexible. One of the things that I will tell you, because I get a lot of emails from students who are trying to schmooze their way into medical school. They want to help do research. They want to get a good reference. There are a lot of people these days who just show up, and they think just because they show up, that's going to get them what they want. I can tell you that the people that you are going to show up to are an older generation, and that's not the philosophy that we had growing up. And so actually what you have to do is show up and stand out. Otherwise, you're just in the crowd. And again, the older generation doesn't appreciate the I'm here, you need to help me. Your philosophy going into whatever you're going to be is I'm here, I'm going to help you, because that creates a relationship that's important. If Jaylene comes and says, you know, I really want to try and get into medical school, and she says, you know, I want to work on your projects, and she doesn't show up half the time, or she says she's going to do something and she doesn't turn it in to me, I'm going to not think very highly of writing a very good reference. But if she stands up and says, gosh, Eileen, I did this, and I actually went ahead and did this other thing that I had heard you talking about. To me, that's like, oh, wow, this person's really motivated. They want to do something. I'm going to write a nice letter for that person. So you have to sort of help each other along the way when you're looking for people to mentor you and support you in your career choices going forward. I think that there's, I'm going to stop there.
You're fine. Do you mind if the students ask you some questions?
No, that's why I was going to let them, whatever they want to ask.
You're fine. So first of all, thank you very much for spending your morning with us, and thank you very much for your sacrifice, because it sounds like you're kind of a Renaissance woman in your career, with the teaching, with studying cardiology, and all of that background. I just can't imagine the amount of hours that you put in. So the students have just a few questions. We're going to start with Jaylene. Jaylene, I'm unmuting you. You should be able to ask your question. You had a really good question for Dr. Handberg.
My question was, what interested you into going into the medical field?
Well, as I told you, when I first started, it was because I knew I could get a job that would pay the bills. It turned out when I got in, I really like taking care of patients. I like making a difference for someone. And not just because, I mean the personal side. I like being able to take care of somebody and have done the right thing and been compassionate with them and made a very potentially bad situation maybe a little bit better, a little bit more tolerated. I've been doing COVID vaccinations for the last month since the vaccine's been available. And just to be able, you know, I vaccinated a 93-year-old lady the other day. And, you know, she was like, she wanted to hug me. We can't hug anymore, but, you know, thank you so much for doing this. And so making a difference in people's lives is important. And I really like being on the cutting edge of science. I like learning new things. I like the fact that what I do is going to result in the medications that you're going to take for heart disease when you get to be 60 or 70. I like making a difference in the world. And so it's been just a nice mash of lots of things, and it's got lots of opportunity. I get bored easily. I like to do a lot of different things. And so it's allowed me to do that.
Very clear that you have a wonderful passion for this. And I like the message that you're passing on to these students, that just find your passions and pursue those passions. I'm going to unmute Angelica. She had an awesome question for you. Angelica, you should be able to ask your question.
Is there any other advice that you would give to anyone who wants to pursue the same career in being a cardiologist?
So people who sort of set a goal and write it down are people who tend to get those goals. So first of all, whatever you guys decide in your career path, I would encourage you, and it might change. I mean, I used to think I was going to do one thing for 10 years and I was going to do another thing for 10 years and another thing for 10 years. And I've sort of done that in cardiology. But you should write down sort of what you think you want to do, and you need to figure out what you need to do to accomplish that, right? You can't just sort of stumble your way through getting into medical school or nursing school. You sort of have to know what kind of grades you need. You need to understand, is going to college a feasible thing economically? I mean, college is not cheap. And so that might be a conversation you have to have with your parents, because if you are planning to go to college and you're going to go to medical school and you're going to do fellowship and residency training, that's a fair amount of money. And so you just need to understand what that financial commitment is and set yourself up. So one of my daughters is now a nurse. And one of the things I really appreciated about her was, I don't know if you guys have this where you are at, but in Florida, there's the thing called Bright Futures. And they use the tobacco settlement money in the state of Florida to be able to fund college education for students in the state of Florida. And depending on your grade point average and the scores on your tests, determines the level of reimbursement that you might get if you got accepted to college. And so one of my daughters took the ACT, and the score was just slightly below the threshold to get the upper level of reimbursement for college credits. And she went back and she retook the ACT to get a higher level of score. Now I can afford college for her, but it helped. And so, depending on your parents and your financial situation, you should have that conversation. Maybe no one in your family's gone to college before, and you might be the first one. And so, trying to have good grades so that you can get grants or scholarships can make a difference, whether college is easier or harder in terms of funding it for you. So would encourage you to sort of think about the path you want to take and then have those conversations now. You guys are all young, but it's important because school's expensive and you don't want to end up with $200,000 worth of debt if you could get grants or scholarships and get out of school, debt-free. That makes a big difference. That's a lot of pressure for when you get done.
So we have and that's great advice, especially nowadays as the kids kind of go off and figure out what they want to do. Christian, he can be our final student question because we don't want to take too much of your time. Christian, go ahead and ask your question. You had a really awesome question that you sent in.
My question is, what are some of the most significant changes you've seen be made to the treatment of cardiovascular diseases over the years?
Ooh. Probably two. One is the treatment of patients who have a heart attack. So as I said before, 25 years ago, 30 years ago, when I first started, you would have a heart attack, you would go in the hospital and you would be on bed rest. And whatever damage happened, happened. And people ended up having very seriously injured hearts that resulted in the fact that they didn't function very well after having a heart attack and they were disabled. These days, because of the technology of balloons going in and putting in metal stents and opening and compressing the blockage, so what happens is they put a balloon into the artery and they open it up, and I'm going to see if I can show you this real quick. They put a balloon in the artery, they open it up, and they put a metal stent in there, and that compresses the plaque back against the wall. And that has resulted in significant improvements in function. And so that's probably been the biggest. The other thing that has changed is the treatment of patients who have hearts that don't squeeze well. Some of the medications that we have resulted in very significant improvements in how people live with hearts that don't squeeze. I'm going to turn this around and show you what I mean by having heart attack. Can you guys see this? Can you see that?
If you lift it up a little bit and then put it towards, yeah, there we go.
Okay, so this is what plaque looks like in a coronary artery. And when you have a heart attack, you go to the hospital, and what happens is you see that wire in the middle of that plaque? Whoops, hold on, see that wire? So what they do is they put the wire in, I'm gonna have to try and do this with my fingers here. They put that wire in, they put a balloon in, they blow up the balloon in the artery in the heart, then they compress it, then they take that out, then they bring down a metal stent, they open that stent up, they take the balloon back out, and what you have is you have this stent in the artery, keeping that artery open. That's all technology that's happened in the last 15 to 20 years. And this is why people do very well from a heart attack standpoint, because now the blood vessel is open. And this is what they mean when somebody says, I had a stent put in. Does that make sense?
Yeah, absolutely. And it's pretty cool having it explained by an expert. So we know that you have a very little amount of time. Before we let you go, can you tell the kids whether they want to go into cardiology or some other field of medicine or something completely different? You had pointed out that you weren't setting out to work in cardiology. What kind of advice would you give to the kids as they go off into the world kind of discovering what they want to do?
I would say keep your mind open and try new things. When people give you opportunities, try it. You just don't know where your passions might be. And so when people give me opportunities, I generally just say yes, because Ralph emailed me and said, could you speak to my students? I'm like, who are you and how'd you find me? And so, this has been a great opportunity. And so, I try and say yes more than I say no, because you get to meet a lot of different people. You get to explore a lot of things, and you should be happy in what you do. And you can make a decision, your first decision, and you can decide, I'm going to go be a lawyer. And you become a lawyer and you're miserable. You should not stay as a lawyer. Either turn that lawyer opportunity into something that makes you happier, or go back to school and be something else. Life is really too short to be unhappy. And work is a lot of your life. So you're going to spend 8 to 10 hours a day doing what you're doing for work. So you should do something that you really like to do. And don't be afraid to change your path. Be flexible.